We, NHS doctors, are urging NHS leaders and the government to pass bold post-COVID-19 legislation to allow for rapid, nationwide changes to the unsustainable food environment in which we currently live.
This food environment has added to the UK's COVID-19 pandemic death toll.
As healthcare professionals, we are concerned that business will restart as usual after the pandemic.
It's not acceptable that the NHS is collapsing under the burden of chronic diseases, many of which can be prevented or treated by simple diet and lifestyle change.
We are willing to take on the task of shifting the NHS focus from a reactive healthcare system to one that promotes health and prevents chronic illness. We share the following concerns.
3 in 4 of the world's new or emerging infectious diseases have come from animals and are mainly transmitted through the wildlife trade and factory farming.
The increasing demand for cheap meat is contributing hugely to environmental degradation and the rise of antibiotic resistance.
90% of global wild fish stocks are overfished. Farmed fish are contaminated with antibiotics and harmful chemicals that pose a risk to human health.
A diet high in processed foods and animal products is driving the epidemic of chronic disease and increasing the risk of dying from COVID-19.
This is of particular concern for communities of lower socioeconomic means and is disproportionately affecting minority ethnic communities.
NHS leaders and the government need to act in the interests of the people and the planet rather than the interests of the corporate sector, who have contributed to the current climate and healthcare crisis through aggressive lobbying and marketing techniques. We propose the following changes.
Taxation and cessation of subsidies for industrial animal farming, junk food, fast foods and soft drinks producers.
A ban on junk food advertising and any market manipulations which aim to increase a consumption of unhealthy processed foods and drinks.
Subsidies to support the UK population to adopt a predominantly whole food, plant-based diet for both human and planetary health.
Promotion of a plant-based food system through the adoption of a no-till conservation agriculture system will lower carbon emission and avoid the risk of us entering a post-antibiotic era.
Protection of the oceans by discouraging overfishing and reducing the reliance on fish consumption, switching to alternative sources of omega-3 fats.
Showcase healthy, sustainable eating through public sector catering in hospitals, schools and prisons.
These actions need to be fully embraced by NHS leaders and the government, who should now place the nation's long-term health at the centre of their policy.
We stand ready to act. Will you?